Hey guys, this is Martin from Reform. This is a very specific video about shoulder function. So I'm going to give you 3 exercises to start working on that shoulder joint. Usually shoulder joint problems will be as a result of really bad posture, really bad kyphosis. So for the most part, there's no use doing shoulder exercises without getting your spine alignment, your spine motion adjusted. And that's something we can do in the office. But this specific video, I'm going to show you 3 things, because if you do need to do shoulder rehabilitation exercises, this is where I always start. The 3 basic motions we want to start with are something that's called external rotation. So it's going from in to out. You'll notice nothing else is moving apart from the shoulder joint. Second, internal rotation, starting out, coming in. Third one is abduction. So it's just bringing your hands out to the sides. And I'm going to get very technical with these 3 because they're not as easy as they look. Okay. So first of all, the whole point of shoulder rehab is you can't do it if you're rounded or rounded. So spine forward or shoulders rounded. So before you do any exercise, you have to be tall through the chest with your shoulders. We call this retracted, so a little pinch back, okay? So that's the first thing. And if you have kyphosis or internally rotated, what's called protracted shoulders, get those looked at first, okay? So once you're in good spinal, good shoulder, first one is what we call abduction. So you're gonna get TheraBand, $5 at the drugstore. This is 5 feet. Blue is very, very light. They come in different weights, but just get the lightest one possible. You're going to stand on it with 1 foot, and you're going to drop this hand to your side, just where there's a little bit of tension on it, and you're going to come up about just under halfway. Okay? Technically, it's about 25 degrees, but if we come up just a little bit and back down, okay? And you can do this 12 to 15 times in a row, nice and easy. Again, the tricks with this are chest tall, shoulders back. You'll notice this arm is not out to the side, it's a little bit in front. You start down with some tension on the band, bring it up, bring it down. Super simple. That's what we call abduction, and it works some very specific muscles stabilizing your shoulder. Second, take this band, tie one end around something like a door handle, something that when you pull, it's not going to fall over, which is the trouble we have filming these sometimes. So it's tied onto something. Your elbow is at your side, but not into your side. Okay, so about 1 inch away. You're starting this first one all the way out. Okay, that's what we're going to start in what's called external. You're going to grab the band in external, and you're going to gently pull all the way into internal. You're going to hold, let it go, let the tension pull you all the way back out, and back in, and back out. 12 to 15. So that's starting with internal rotation, starting in external rotation, finishing in internal rotation. So far, so good. Next one, I'm going to have my back to you because it's the same thing but opposite. So I can either turn my back to you or I can move the rope to the other side, the band to the other side. Back to you is very simple because you're going to see this motion that this time you're going to start in, you're going to grab the band, you're going to go out. You're going to start in and you're going to go out. And you go in, you're going to go out. Okay. Lots of information, but 3 key movements. We're doing abduction, internal rotation, external rotation, all banded, okay? And again, I would say literally 90% of the bad shoulders I've seen in here are because the spine is bad. The neck is getting damaged and it's causing arm pain. The posture is bad, so it's messing up the shoulders. The spine here is bad, and so it's pushing the whole shoulder blades forward. So this is a multi-step process to get the shoulder out of pain. Obviously, if you need an assessment, you can contact me or I can refer you. But tall, back, exercise it out. See you later. It's Martin at Reform.